It's Dr. May from Break the Cage MD. I had a fun experience the last couple of days because, as traffic grows, so does the medicine traditionalist group. Uh, so, in medicine, they're forever anything that they don't understand is pseudoscience. So I was like, he's a scam, pseudoscience. Brilliant. Basic math, pseudoscience. Um, one of the things I wanted to do was I wanted to go back and try to get an idea of, what life had been like in medical school. And And I remember it was always like, well, why didn't you leave earlier? It's because you're not allowed to think. Anytime, like in medicine, you're at a really concrete level. Okay. You don't really know the stuff, and you're ashamed to say you don't know the stuff. And so anything that you don't understand and you think doesn't fit the mold of what your seniors are saying, you call pseudoscience. It's a very mechanistic place. They don't understand nonlinear dynamics, they don't understand systems dynamics, and they don't really know how to do critical thinking. It breaks my heart. But I remember being there. And it's that I talk about this all the time, ritual and procedure. So it's like, why didn't you leave earlier? Um, because what happens in shame culture is they always attack you. They always make you feel like it's your fault that bad things are happening to you. It's your fault that Medicare is paying less. It's your fault that you're working 88 hours a week and you're getting sleepy. And I read this article today that doctors have, when they come back from sick leave, they feel shame for being sick. It kind of tells you how they feel about the patients and how we've been conditioned. Yeah, it's interesting because I just I remember being there. I remember being there, and I'm really glad I'm not there anymore. I'm so glad. So toxic, but yeah, I remember being afraid to think because all I wanted, all I wanted was to be a doctor, and all I wanted was to stop feeling ashamed because I was having trouble absorbing this fire hydrant of information that was coming at me. And I thought if I studied more, that would work. I thought if I learned the surgery stuff better, that would get approval. I thought if I carried more patients, that would get approval. None of that's going to get you approval. None of that ever gets you approval. It's not the culture of medicine to do approval. It's like a narcissistic parent. It's driven by shame. It's driven by bullying. It's never, ever, ever going to approve of what you do. Think about it. Breathe the cage and be.